Okay, thank you, and Honorable Representative Davis and fellow subcommittee members. I come before you today to share the reality of living with a disability, a significant one that I've had since birth. No, my hair did not come out gray at birth, but I live in my own home, I live in the community, and I live with community attendants for the past 40 years. I could attend UT, get my degree in social work, and all that with the help of attendants. I began my career as a VISTA volunteer and then took up on a management position for a program to teach people with disabilities how to tackle the hurdles of living in the community with the help of attendants. You'll kind of see a theme here. I then took on my life career as a transportation ADA expert and a community outreach specialist at a wonderfully accessible transportation authority for 21 years. All the while, I had attendants get me up, help me potty, get dressed, brush my hair, get me going, and make my house a home. I'm an individual who has been using attendant services through the Consumer Managed program. With my strength, with my age, my strength is withered, and my needs for assistance increase. If it weren't for these attendants who work with me day in and day out, I truly believe I would not have been able to make a life for myself, and more than likely would have come to an early death. No institution can ever cover the inexpensive assistance I have received. Now I'm retired. I volunteer my time to help HHSC with my time and life experiences to help keep programs in the community. It's very economical. And I'm not an accountant. But in my 40 years of recruiting, training, and supervising my needs through the hands of an attendant, I've found the workforce is getting older, not just me. No one wants to work for the low pay of $8 an hour. No benefits, no sick time, no holidays, no respect from our state. No one can afford to work as an attendant. To my horrors, several attendants just recently have had to take on higher paying jobs, leaving me to search for more. I completely understand, but if I could pay $13 an hour for their help, I would, but I can't. I'm competing with Dairy Queen, their competitive salaries. That's a frightening thought. My latest dilemma was that some attendants needed the job to subsidize their state benefits. And that's just a conundrum I can't get my hands around. It's as if we are using the same pot of money. What have we created? We've created a turmoil and a crisis. We have found the problem, and it is us. I cannot do without an attendant. I cannot live without an attendant. I cannot live. Please understand from where I sit, in my wheelchair, and in my shoes that my attendant put on me today and every day, the future is very, very bleak. Briefly, I'm requesting higher competitive wages, $13 an hour, benefits, respect from the state to help people help themselves, Attendants deserve our respect for decades, saving the state money in the cost of an institution, a true return on our investment. Thank you for listening.
Thank you for coming and for your testimony this morning.